I'm a senior citizen. My husband is also a senior citizen. I'm a diabetic. My husband is also a diabetic, and he has COPD, low platelet count. He has many illnesses. And I have 2 beautiful grandchildren, and I take care of them a lot. And I have my flu shot every year, and I keep up with my updates on my pneumonia shot, because I feel it's very important to keep myself healthy so I can keep my grandchildren healthy and my family healthy, so I can do what we need to do for everyone.
Healthcentric Advisors has been a proud catalyst for healthcare quality improvement, supporting the Triple Aim and CMS's Strategic Improvement Plan for over 20 years. We have been a leader in increasing immunization rates for both influenza and pneumonia. Consistent outreach and messaging disseminated far and wide are some of the keys to our success, resulting in notable improvement. We begin by focusing on the beneficiary and meeting them where they are. So, where did we find them? Everywhere, in every task order, across multiple settings, and throughout the community.
Another way that we reached the public was to go and place articles in some of the local newspapers. We have a Senior Digest newspaper. We also have a Contester Latino. We did a 6-part health series on Latino public radio. We also did beneficiary-facing newsletters focusing on immunizations, as well as we had a very successful social media campaign.
And I think it was really important for the program to be delivered in Spanish on a Spanish-speaking radio station, because the listeners tend to be elderly, and these are people who more often than not were not born in the U.S., and they bring with them ideas that are not as evidence-based around immunization. We can see that in one study I was looking at in the New York City area, where the foreign-born population, Spanish-speaking, had a lower vaccination rate than their children who were U.S. born.
So, who is missing from this picture? Oh yes, the healthcare community, but who specifically? Physicians, PAs, NPs, nurses, pharmacists, medical assistants, front desk staff, CEDOs, home health nurses, home health staff, SNF staff, quality improvement staff, and the immunization clinic staff. Messaging to healthcare teams came in a lot of different ways. In person, e-newsletters, a 4-part podcast series, email blasts, webinars, website tools and resources, and participation in professional events and in printed materials.
To improve our vaccination rates, we implemented every patient, every visit workflow. We instructed our staff to offer vaccines to all our patients at every touch point. We implemented standing orders for our influenza and pneumococcal vaccines through standing orders, offering vaccines at every visit, and educating our patients and staff. We've seen an increase in our vaccine rates every year. Even though our project was specifically for Rhode Island, what we did was we made sure that it was a regional as well as a national effort, because the information that we were disseminating applies everywhere. A lot of our webinars and our printed materials we shared across the region, but also across the country, and allowed for other areas to be able to benefit from the materials.
And I'm so happy that I work with Patient Family Advisory Council, because I've learned so much about health and prevention. I want everyone to be able to enjoy life like I have.